Miss Navodi has been having few health complications that has been affecting her daily life. She scheduled an appointment with a doctor to discuss her health complication. As the day of the appointment arrived, she went to the hospital for the appointment. She met the staff in the hospital and mentioned her appointment.
Good morning. I have an appointment scheduled to meet Dr. Elby. Could you refer me to her room, please?
Good morning, madam. Let me check the database for a bit. Yes, Dr. Albi has an appointment with a patient named Navodi. So, madam, can you please show your ID to confirm your identification?
Okay, sure.
Thank you, madam. Yes. Thank you for the cooperation, madam. So let's proceed to Dr. Albi's consultation room. So this is the room. So you may head inside as doctor is waiting for you, madam.
Thank you for your help. It's much appreciated.
Miss Navodi enters the room to meet the doctor. She explained her health complication. Dr. Elvi asks about her medical history and take a look at the report that she brought along with her. She had to undergo a few tests before attending this appointment. The doctor then gave her a recommendation on what to do regarding her health complication.
Good morning, Dr. Elby.
Welcome. You must be Miss Navodi.
Yes, it's me.
Please have a seat. So, Miss Navodi, can you please tell me why are you here today?
Well, I've been fainting a lot recently, and there's vaginal bleeding also very often.
Can you please pass me your test reports? Miss Navodi, can you please tell me about your previous medical and surgical history? Hopefully you can recall everything because this information is important.
No problem, doctor. I can remember them clearly. I've suffered from a deep vein thrombosis while using combined contraceptive pills.
Can you tell me when was this?
It was about 20 years ago.
20 years. Okay, you may continue.
I've also had a laparoscopic bilateral tubal ligation. And, oh, before I forget, I get heavy menstrual bleeding due to multiple uterine fibroids.
Thank you. This is valuable information. I need to check your heartbeat, okay? Your heartbeat is 120 beats per minute, which is higher than normal. And I found out from your test result that your blood pressure dropped when you stand up.
Oh, is that bad, doctor?
It's okay. What's important here is you need to stay calm during the whole process. Alright?
Okay, doctor.
Okay, Miss Navodi, after listening to your history and taking a look at your test result and making the analysis myself, I decided to schedule you for a surgery today, and it will be with another doctor.
Thank you so much for your time, Dr. Elvi.
Please be prepared. Thank you.
Miss Navodi waited in the hospital for a few hours before being approached by the staff. She was brought to meet the two doctors.
Hello, good evening, doctors.
Hello, Miss Navodi. This is Dr. Dania, and she will be assisting me for your surgery today.
Good evening. I am Dr. Dania. Pleasure to meet you. Would you lie down here, please?
Okay, sure.
Dr. Dania, please check her vitals and give her general anesthetics.
Alright, so her pulse rate, temperature, blood pressure, respiration rate, they're all normal. Her vitals are normal, doctor. We can begin the surgery as soon as I sedate her.
I'm feeling a bit weak and drowsy.
Dr. Elvi and Dr. Dania successfully complete the hysterectomy on Miss Navodi. Later, they have another surgery needed to be performed on the same day as scheduled. Dr. Elvi and Dr. Dania was then contacted by a nurse regarding another hysterectomy scheduled for the day.
Sorry, Dr. Avi and Dr. Daniha, but you have another hysterectomy surgery scheduled at 4 a.m. So I'll suggest you to stay at hospital and prepare for the surgery.
And there goes my sleep. Okay, noted.
The doctors went to the operation theatre to begin the surgery. The nurse there had prepared everything. The nurse was tasked to monitor the patient's blood pressure and level.
Hi, how is our patient doing?
Hello, doctor. Our patient is doing fine and
How about her vital sign?
her vital signs are within normal limits. And the surgery has been scheduled later today. So should we proceed?
I'll meet the patient first and see if she has any problem or any questions, and if there is no doubts, then we can proceed.
All right, doctor.
The doctor went to see the patient and asked if she has any doubt regarding the surgery. Once the doctor has cleared all hesitation from the patient, the doctor informed the nurse to get the operating room ready for the surgery. Before the surgery, all the staff who are involved gather for a quick briefing to ensure everyone understood with the procedures.
Attention everyone! Before we start this surgery, I just want to briefly explain that the main surgeon will be me, and I will be assisted by Dr. Dania and Nurse Kashira. Does anyone have questions or confirmation they would like to ask?
Are all the equipment prepared and ready?
Yes, doctor. All the equipments are ready and all the monitors has been switched on.
The total laparoscopic hysterectomy surgery has begun, and the surgery was smooth sailing until suddenly an uncontrolled bleeding occurred. The bleeding was severe, so the doctor instructed the nurse to proceed with a massive blood transfusion.
Her blood pressure is getting higher. We should contact the blood bank.
Nurse Kashira, contact the blood bank and let them know that we need a few more pills of blood.
Sure, doctor.
Upon arrival of the blood products, the patient was immediately transfused. The surgeons complete the hysterectomy but continued to observe significant and diffuse pelvic bleeding. At this time, a surgeon noted that the blood being transfused was not O negative blood. The anesthesiologist was alert and he immediately stopped the transfusion.
Wait a minute, this is not the compatible blood for this patient. She should be transfused with O negative.
Okay, I've stopped the blood transfusion. Inform the blood bank about the accident and tell them we need O negative blood stat.
I had notified them about the error, so the blood bank personnel actually incorrectly assumed that the MBT that was initiated for the patient who had tested positive for the antibodies. So right now they are on their way here with the O negative blood.
The operating room staff removed all blood product from the operating room, and new O negative non-cross-matched blood was sent. They proceeded the surgery until it was complete, and the patient was brought to the ICU. Once stable, the patient was taken back to the operating room for removal, pack of packing and re-exploration, where no active bleeding was noted. Fortunately, the patient recovered from near fatal injuries, and she was eventually discharged home with a close outpatient follow-up.
Congrats, team! We did a great job, even though there was some problem during the process.
Well, yes, we did do a good job. However, that was an error that could have easily cost the patient's life. We have to make sure that it does not happen again and make sure everything is sorted out before the operation.
You're right, doctor. I will make sure that everything will be smooth in the future. By the way, great job, Dr. Alvi and Dr. Daniha, for your great work.
From this story, we can learn that despite having a very tight schedule, the medical officers still try to give their best for their patients. They give a very good service for their patients. They show a very good teamwork as well as reflected their mistakes in order to avoid complications in the future.